Why your pain isn't going away, and what actually fixes it. Our 10 top questions from our patients, presented by Men's Health USA.
Let's start with the biggest question. Does shockwave therapy actually work? Because what most people are really thinking is this just another gimmick? Is this just something that's not going to fix the pain? Well, let's be honest, that's fair. That's a fair assumption. But when you look into the actual mechanics of shockwave therapy, what do you see? Well, shockwave therapy works best for chronic soft tissue pain, meaning pain that it's been there for a while, been there for 3 months or longer, and hasn't fully healed, and it's just causing pain. Let me give you some conditions. Plantar fasciitis, shoulder tendon pain, for example, tennis elbow, chronic knee pain that's just not going away, that just aches. These are often not just strength problems or just flexibility problems. They're healing problems. Shockwave therapy actually stimulates blood flow. It stimulates collagen production, even stimulating cellular repair in tissue that has been stalled. It doesn't mask pain. It activates your body's repair response. That's why the right candidates see real improvement. Now, another question that we get quite often is, how many sessions will I need? Well, here's the honest answer. Chronic tissue doesn't remodel in just one visit. If pain has been there for months or years, the collagen structure has changed. That means blood flow is reduced. Healing has slowed. Most moderate cases improve in about 3 to maybe 6 sessions. More chronic, long-standing cases may need really about 8 to 10, 12, even 15. But here's the key. The first session tells us something important. If your body responds from the first session, meaning your pain decreases even slightly, maybe your mobility improves even slightly, that tells us that your tissue is capable of repair. That's why we offer a test session to see, is this going to work for you? You don't have to commit up front. We test your response first. Now, another common concern we hear is it going to hurt? Does it hurt? The honest answer is it can feel a little uncomfortable, really at first, during the treatment. But there's a difference between injury pain and productive discomfort. Now, when you say shockwave, we're not talking about, hooking yourself up to a medieval, electric chair. But we're talking about acoustic shockwaves. Shockwave creates a mechanical stimulus in that tissue. That stimulation is what actively repairs the body. Now, sessions typically last about 10 to 15 minutes. They're actually kind of short. The intensity of that session is adjustable. So most patients tolerate it very well. Many will say it wasn't nearly as bad as they expected, but they felt a little discomfort, and that discomfort dissipates. The key thing is this: there is no downtime afterward. There's no cool down session afterward. You walk out of there the way you came in. You return right back to normal activity. And that's what you want as far as a treatment is concerned. Is it safe? Well, safety does matter. But shockwave therapy has been used in medicine in the US for decades. In Europe for the last 40, 50 years. It's non-invasive, meaning there is no incision or anesthesia, no surgical risk. There's minimal complication risk when properly administered. That said, it's not for everybody. We don't treat acute fractures. You break your arm, this is not the place to go to, or don't get this type of therapy. We do have to screen for certain medical conditions. We assess structural integrity first. We only treat what is appropriate And when you're getting shockwave therapy, you want to go to a place that will treat you when it is appropriate to treat you. The goal isn't just to sell you some sessions and sell you the hope of maybe this can help you. The real goal is to help the right candidate get the right treatment and get back to the normal activities that you desire to do. One of the questions that we get is, why not just do a cortisone shot? Do physical therapy, which is important. Surgery, which can be very important. But we have to have this comparison to really understand the risks and the benefits. So when it comes to pain medication, it will reduce the symptoms, but it will not improve the tissue quality. Cortisone, fantastic. It's synthetic cortisol. It reduces inflammation temporarily, which can bring down pain, which is great. But repeated injections just weaken the tissue over time, and it doesn't fix the problem. Physical therapy, on the other hand, is extremely valuable. But if the tissue that you're repairing through the activity, the physical therapy activity, if it isn't actively repairing, strengthening it alone will not solve the problem. Surgery can correct structure, the structure, but it comes at a cost. It comes at enough downtime for recovery, and of course risk in surgery. Shockwave is different. It stimulates cellular activity, specifically blood flow and collagen remodeling, which improves the quality of the tissue itself. We're not trying to suppress pain. We're trying to restore the tissue health. Thus, no pain. Why hasn't my pain gone away yet? Now, many people assume that if pain hasn't gone away, it must mean they're just getting older, right? That's usually not the real reason. Chronic pain often persists because of reduced circulation, collagen degeneration, and stalled repair cycles. So tendons and fascia have limited blood supply even to begin with. Once healing slows down, it can stay slowed down. Stretching doesn't fix that. Rest doesn't fix that. It can help, but it doesn't fix it. Even strengthening the muscle doesn't fix that. You have to stimulate the healing processes again. That's what this therapy is designed to do. Tell the body, start the healing process again to fix what's not fixed. Now, what if my pain has been there for years? This is actually a really common concern. People will say, my pain has been there for 5 years, 10 years, what have you. It's too late for me. And the truth is, chronic pain lasts years. Doesn't mean that the tissue can't heal. It usually means that the healing process has just stalled a long time ago. So tendons and connective tissues have limited blood supply. When an injury occurs, they often repair partially. Makes you functional, but you're not completely healed. Over time, the collagen fibers became disorganized. Circulation decreases, and the tissue just stays stuck in a weak and irritated state. That's why when certain weather occurs, what do you feel? Well, I feel a little pain today. Oh, this is stiff. That's why stretching, rest, and just that occasional therapy just doesn't fully solve the problem. What treatments like sound wave or shock wave therapy are designed to do is to restart the healing process, improving circulation and stimulating tissue remodeling. So even if pain has been present for years and years, the tissue can still respond if we trigger the repair mechanisms all over again. That's how great your body can be. Will the pain come back? Another important question people ask is if this works, will the pain just come back later? Then I have to deal with it all over again. Well, the honest answer depends on one thing: whether or not the underlying tissue actually repairs. Well, temporary treatments often reduce inflammation. That's great. They numb the pain signaling. That's not so great. That can feel better for a day, a week, weeks, a month even, but the tissue itself hasn't changed. What we aim to do here is to stimulate actual tissue remodeling, meaning stronger collagen fibers, improved circulation, better structural integrity. When the tissue quality improves, the pain signal often disappears. Why? Because the tissue has healed itself. The body is no longer protecting a weak or an irritated structure. So of course, lifestyle matters too. You know, your activity, your mobility, your strength. Very important to strength train. But when the underlying tissue heals properly, the improvement tends to be much more durable than simply symptom-based treatments, meaning just getting the pain away. Heal the body, and the pain naturally goes away. Why do athletes and professionals use this treatment? You may have heard the professional athletes like use shockwave therapy or acoustic therapy or sound wave therapy. And the simple reason is this: athletes don't want treatments that just cover a pain. Why? Because they have to perform. They want treatments that will help the tissue heal, repair fast. So high-level sports medicine uses technologies that stimulate blood flow. Of course, you are going to need things like a cortisone shot sometimes to take away the pain so they can play through that pain for that period of time. But to heal the problem, you need consistent, constant treatment that's going to stimulate repair. That's why this therapy has become widely used in sports medicine with conditions like plantar fasciitis, Achilles tendonitis, patellar tendon pain, and shoulder injuries. The goal is it's not just pain relief. That's necessary, but it's not just pain relief. The goal is restoring the tissue so the body can move normally all over again. How do you know if you are a good candidate for shockwave therapy? Now, this is a question that we get many times when people come into the office. Not everyone is the right candidate for this therapy, for this type of treatment. And it's important to know this or determine this before you start a program. That's why we kind of offer that one-time treatment to see how your body responds. During the evaluation, we're going to look at several things, like where the pain is located, how long it's been presenting, how the joint actually moves, how the tissue responds to pressure and movement. Many chronic tendon and fasciae problems respond very well to this therapy. Some do not. However, if we find something like a major structural tear or a condition that requires a different approach, we have to discuss that separately and honestly. The goal is not to sell treatment, because treatment that doesn't treat, what is that? It's nothing. The goal is to determine whether your body is likely to respond. That's exactly why we do the test session, is to see, okay, how's your body responding to this? If it responds, we have a high likelihood that more sessions, the right number of sessions, can heal the problem and get you back into the function that you want. So, here's the bottom line. You don't need to commit to a long treatment program today. We offer a $79 pain reset session. We evaluate your pain. We treat the specific area. We reassess right after, and we reassess a few days later. If you feel a measurable improvement, we know that your tissue responds, and you can look at a program for a number of sessions or a period of time. If you don't feel an improvement, you don't pay. That means it's zero risk. You have nothing to lose. If you've been living with pain for months, for years, pain in your knee, your back, your shoulders, this might be the step that you need to take to finally get things moving forward, to move from pain to freedom. And there's no risk. So we look forward to seeing you.